Well, as things continue to evolve in the fight against COVID-19, there's now talk of some new symptoms to look out for. Dr. Rob Danoff is on the front lines in the battle against the coronavirus. He's overseeing a testing center for Jefferson Hospital in Bucks County. He joins us now on Facebook Live. Dr. Rob, good morning. Thanks for joining us again.
Good morning, Jim. How are you?
I'm doing really well. Can you tell us about these new symptoms?
Yeah, it's interesting. So in other countries, and we're starting to see it here, loss of taste or loss of smell or both may be the only symptom and the early symptom of someone with COVID-19. And so the people with that tend to do very well. So please don't get extra scared. We will test you, tell your doctor about those symptoms if you have it. Doesn't mean you have that disease, but we're seeing more of it. So please be aware. Now, also, there's some other good news out there. It turns out some studies are showing that most people with symptoms develop antibodies to fight this disease early on. That's why the majority, at least 80 to 85% of people who get this, have very mild illness and do well.
Good, Dr. Rob. Dr. Rob, there's a lot of crazy stuff floating around on social media. There was some knucklehead down in Florida saying, blow a hairdryer in your face and that's going to kill the virus. People are saying gargle. With all these things out there, where are we with potential treatments and medications?
There are 4 clinical trials going on right now. Some are promising. So they're really trying to expedite this and see what's helping. I can tell you that in other countries and even our countries, some people who are, critically ill in the ICU, they are using some of these. And some have shown some good results. It's still too early to definitely count on them, so just stand by. But I would say, please, don't go out to ask your doctor or the pharmacist for hydroxychloroquine or chloroquine. We don't know that that works yet, and they can do more harm than good. But keep in touch because it's being worked on very quickly.
So how are things going at your testing site that you're overseeing? Have you seen an increase in patients there?
Yes, absolutely. And some patients with mild symptoms, certainly. We've seen some with more symptoms. We are still seeing flu out there, so just everyone be aware of it. Influenza is still out there. We are testing more people. It's been very calm. It's by appointment. And as long as we provide information, that's very helpful. And in South Korea, where they shelter in place in a lot of other countries, that's been shown to stop the spread of virus. So I want everyone to know you have just as important a role as anybody, because by you staying home, you're protecting not only your family, but other people. So we're all playing a role, and this will help us get through this in a good way.
Well, Dr. Rob, besides spreading the virus, there's also a spread of fear going on right now. So what's your message for the people out there that are watching right now?
Yeah, the biggest virus right now is really not a virus, it's fear and anxiety. So the best thing is don't, keep on news all day or, reading about this all day. Do some other stuff that makes it normal. Know that there are a lot of people working on this, looking after you. We have good processes in place. The shelter in place is very effective. And then we're going to get through this just like we always do. So please look to try to get some normalcy in your life. The sun will always shine. We're going to get through this. Okay.
Thank you, Dr. Rob. We appreciate it. We'll check in with you later this week. Stay safe, my friend.
You too. Thanks.